Hey, it's Roberto Miki again, and we've got another great question in our Hand Question of the Week series. It's number 22 in our series of questions that are for medical students, residents, and fellows taking the in-training exam or boards. Well, let's get right into it. It's an osteoporosis question. Ramosumab is an antibody which blocks sclerostin and is used in the treatment of osteoporosis. Which statement best describes the role of sclerostin in bone metabolism? A. Produced by osteocytes inhibits osteoblasts. B. Produced by osteoclasts inhibits osteoblasts. C. Produced by osteoblasts inhibits osteoclasts. D. Produced by osteoclasts promotes osteoblasts. Or E. Produced by osteoblasts promotes osteoclasts. Well, here's your chance to pause the video so you can think about the question and answer it yourself. Osteoblasts produce bone, and osteoclasts destroy bone. Osteocytes are cells within bone, and they actively participate in bone regulation via sclerostin. Osteocytes produce sclerostin, and sclerostin inhibits osteoblast maturation. Sclerostin production is inhibited by stress placed on bone. Various experiments involving unloading of bone and microgravity environments such as the space station have demonstrated the key role of sclerostin in sensing stress on bone. Sclerostin is the product of the SOST gene. The gene is mutated in humans with a condition called sclerosteosis. These patients have extremely dense and strong bone. If they're homozygote for this gene, they are extremely tall, have thickened mandibles, and often go deaf because their bone never stops growing. This population is almost exclusively seen in South Africa amongst the Afrikaner or Dutch immigrants there. It is a fantastic story, and you should read about it if you're interested in the history of medicine. And this is the basis for the new drug. And it's a wonderful story about medicine, and you should read about it. But let's get back to bone metabolism. So in this drawing depicts basically bone metabolism in a very basic sense. There's osteoclasts to the left, those orange cells. You have the osteoblast center right, the blue cells that line the bone there. And then you have the purple cells to the right that are in the bone. Those are the osteocytes. And it's the osteocytes that we're interested in this lecture or question. Osteocytes produce sclerostin, and that sclerostin then goes and blocks the osteoblast lineage. Sclerostin production goes up when there is less stress on bone. So if a bone is stressed, you produce less sclerostin and your osteoblasts are not inhibited. But if you have less stress on a bone or part of the bone, that part of the bone will produce more sclerostin, and hence the osteoblast will be inhibited in that area, and you'll produce less bone there. Sort of following or manifesting Wolff's law. Wolff's law says that basically if a bone is stressed, it will react to that stress. Well, this is the negative feedback. So if the bone is not stressed, it produces sclerostin and then inhibits the growth of bone in that region. So the answer to the question is A, produced by osteocytes and inhibits osteoblasts. Hope you enjoyed this video. Hope you learned something, and we'll see you at the next one. Remember to like and subscribe to help support this channel.